So hello, here we are again at Enerpeel training application. So today we are looking at Enerpeel Mandelic acid, 40%. We're using mandelic acid because it doesn't trigger erythema. It's a very safe peel to use. It is used as a summer peel. It's used on sensitive skins and hyperreactive skins. And it's also used with rosacea patients. Our mandelic acid comes already made up with a 40% mandelic acid split into 20% of the mandelic acid being in the mandelic acid form and 20% being in the mandalate form. That allows us to use the Enerpeel carriers to transport the mandalate into the skin, where it's converted to mandelic acid in a slow release type way, and we know that mandelic acid can have an impact on vascular tissue and helps the contraction of blood vessels. Today we have Helen as our subject, who's already been pre-prepped. Helen has a family history of rosacea and also has a sensitive skin, so she's the ideal candidate for a mandelic acid peel. I should also say the mandelic contains something called MSM, methyl sulfonyl methane. This is an anti-reddening agent which can suppress surface erythema. So again, this improves the safety profile for people who have easily reddening skin, who are prone to hyperpigmentation or have rosacea. So the client is ready. Now we're going to start the procedure. The last point of the preparation procedure before is just to cleanse the skin by using a wipe that contains a number of ingredients that will reduce and remove all the tiny little lipids that might sit within the little creases in the skin. These are quite strong, so we often advise the client to, if they haven't got their eyes covered, to have them closed and probably hold their breath. Now this allows the Enerpeels to engage with the skin better. If somebody's really reactive skin, then we would consider just using an alcohol wipe. Now we're moving on to the active application. You can see here that the vial contains 2 ml of solution. That's an Enerpeel carrier containing the mandelic acid and the MSM. We're using a brush head applicator. The whole principle of Enerpeel is to reduce and minimize any surface trauma. You can see the clinician is just applying the solution to the skin. Now the solution feels quite oily because the Enerpeel carriers do not contain any water. So these peels only activate once they've entered into the skin and rather than on the skin. The idea is to get a good covering by just gently drawing the peel down the brush bristles, not flattening the brushes to the skin, but trying to keep them as upright as possible. Get a good coating, holding a piece of gauze just in case there's any of the peels do run, and you can actually move the client's face around, but the idea is to get a good covering, so you can see that you can actually see the peel on the skin. It will absorb. You can put in additional layers, but today, as Helen, this is her first peel, so we are treating this with caution, and the application time runs from 2 to 10 minutes. About every minute or so, the client will be asked for how they feel in terms of the discomfort. Typically with an Enerpeel Mandelic, the discomfort levels go between 1 and 3 out of 10. If it's more than that within the first minute, then you might decide that they may be hypersensitive even to the mandelic acid, and you would stop it. How are you feeling, Helen, on a scale of 1 to 10?
Just a 1 at the moment. Just
a 1, and the timing's running now. So since the start of application, it took about a minute to apply it. The clinician is happy that there's enough on the skin. We are timing this, and ideally we'll go up to 10 minutes before we will neutralise this. With people who have had previous mandelics or who are known to be good candidates for peels in terms of they're not sensitive or a hyperpigmentation risk, it is quite normal now for at 10 minutes rather to neutralise the mandelic acid, to actually extend it and just remove any surface carrier on the surface and actually leave the mandelic acid in the skin. But you can see another video of that with extended exposure. So now the peel's been running for just coming up to 2.5 minutes, Are we still at 1 or has it gone up at all, Helen?
No, it's still at a 1 at the moment.
Okay, so we're going to pause it here and we'll come back nearer the 10-minute time to show you the removal mechanism. So welcome back. We're coming up to the 10-minute exposure time, and this is where we will look at neutralization. The client is still giving scores of between 1 and 4 out of 10. I think in this case it's probably still 2 or 3. Is that right, Helen?
Yeah, it sort of went up to about 2.5 and it has gone back down a little bit again.
Okay, now when we use the neutralizer is an arginine wipe. So 12% arginine, which is an amino acid. We're using arginine rather than something like bicarbonate of soda because we can also attach the arginine molecules to the Enerpeel carrier, which means wherever the peeling solution has gone in the skin, the arginine neutralizer will track it down. That means we'll stop all of the peel activity on the skin and in the skin. This includes if we were doing a TCA, by the way. With Enerpeel you can stop a TCA, whereas a lot of other companies claim you have to let a TCA run its course. Also, because of the carrier, all of our acid molecules go in the skin, and therefore once everything's neutralized you can wash the face after any of our peels, including a TCA, because now you can see we did the blotting technique. Now the neutralizer and the Mandelic do have a chemical reaction on the skin, which some people may say it makes it tingle a bit more for a few seconds, and some people may say it goes up to 4 or 5, but that soon dies away. I think we've done the blotting technique. Now I know that Sarah, our clinician, has squeezed some of the neutralizer into her hand and then blotted that onto the skin. The more neutralizer you get onto the skin, the better. The other technique would be to squeeze the neutralizer either into a pot or onto the hand and use the fingertips. I've seen a lot of particularly skilled technicians use the fingertip technique. It's more tactile and you can get to possibly more exact application this way. But once we've got that on there, then we just allow everything to calm down. Hopefully you should be feeling that dying off now, Helen?
Yeah, it did go up a bit, but yeah.
Yep, that's fine. That's sometimes some people say that, some people don't. So we'll just let that settle for a few minutes. Just make sure that it's all died down and we haven't missed any areas, particularly paying attention to the eyebrows, around the nasal flare and in the hairline, because these are areas that sometimes get missed. What we're going to do now, as we can do with an Enerpeel, just using some sterile saline solution on cotton pads, we're just going to cleanse the surface so any of the neutralizer Enerpeel carrier or any of the mandelic acid carrier is also being removed from the skin. This allows us then to put the UV and anti-reddening creams on so that the client, whose skin will have thinned in this 10 minutes, the stratum corneum will have thinned by 1/3, and therefore UV protection is important as the skin will be more sensitive to the sun. Over the next 24 hours, the actual thickness of the stratum corneum will go down by another 1/3. This is quite a unique feature of Enerpeels, that they don't have a really acute, sharp drop in the thickness of the stratum corneum. They have this ongoing 24-hour sort of slower effect, so that over the next 24 hours there will be further degradation of the stratum corneum, and then it will start to recover. This more shallow, slower reduction in terms of chemoexfoliation is much less traumatic to the skin, much less likely to trigger a post-pigmentation event, and much less likely to trigger things like hyperpigmentation or excessive erythema. So the treatment's now complete, and you'll find on other videos advice on post-treatment care. Thank you.